Garage time, everybody. Step inside. Today, we're tuning up the elbow. Really common ailment we see in the clinic all the time, elbow tendonitis. Medial epicondylitis, or golfer's elbow on the inside, lateral epicondylitis, tennis elbow on the outside. We're going to do this as a two-part series. So today we're going to do phase 1, and you can check back in for phase 2 real soon. So I've been dealing with this one for a while, and let's be honest, once this sets in, it's like the uninvited house guest that won't leave. And if left untreated, it can be super damaging. People come into the clinic all the time saying, I can't even lift a coffee cup because I've got so much pain and I've lost so much strength in my hand. For me, not being able to drink your coffee, that's an escalation to DEFCON 5, and we better take care of it as soon as possible. So I want you to use today's information as a treatment program if you've got pain, or a possible prevention program if you're somebody who very well may be at risk for developing some elbow pain. So how do you know if this is you? Well, if you're me, you develop the pain by doing lots of gripping work at the gym, heavy lifting, pulling, pull-ups. If you've got a job that requires lots of grip and work with your wrist, you're in construction, you're swinging a hammer, spinning a screwdriver, you're sitting at your desk and you're typing all day long. These are all ways to junk up the forearms, and eventually that's going to pull on the elbow. So we want to do some soft tissue work, because what's happening here is we've got adhesions, trigger points all up and down through the forearm, and then we've also got weakness or lack of endurance in the musculature in the forearms that eventually is just breaking everything down because you're not stopping doing what you're doing and resting. So in phase 1, we're going to hit up the soft tissue. We're going to work on the tightness part. Lacrosse ball, you can go double lacrosse ball sometimes to prevent it from kind of flying all over the place, but I find that the single kind of hits the spot just right. Now I've had medial epicondylitis, so on the inside, so I've had to spend more time on the palm side of my forearms. If you're dealing with tennis elbow, the outside of the elbow, you're probably going to spend more time on the top, but you're going to have trigger points everywhere, so you're really going to want to work everywhere around your forearm. Remember, soft tissue works a bare minimum of 5 minutes. If this is a serious issue, it very well may go longer for you. Start right up around the elbow. Hand on top, a little bit of overpressure. Find the first sticky spot. Go side to side over it. Move up and down. Contract, relax so that you can settle into it and take some weight. And then what I find to be the most effective is range of motion of the wrist. Up and down, side to side, circles, rotation, otherwise known as pronation and supination, until you start to feel the pain dissipate. Then just work down along into the muscle belly, find some stuff there, all the way down to the wrist. You're going to want to do the top, the sides, all around that forearm because you've got trigger points everywhere. Once you've completed your soft tissue work, bare minimum 5 minutes, but possibly more, some very gentle stretching. We can go old-fashioned, okay, just pulling the hand towards you. These two, I like to get a little bit more pressure, okay? I know you lost my head in this one because I'm standing, but that's cool. We just want to see the forearm, so a little bit palm down. We're going to go 2 minutes like this. We're going to go top of the hand down, straight elbow, 2 minutes like this. And that's going to be your soft tissue work and stretching to start working on the weakness in your forearms to either treat or prevent elbow pain. Phase 2 coming soon, so check back and we'll see you next time.